Welcome to this meeting of the Health and Wellbeing Board. There's some new people and some people who are visiting us and, like Professor Keith, only come once a year. So I think we'll all introduce ourselves first before we get going. I'm David Hare, I'm chair of this, and I'm the executive member for Health, Adult Services and Wellbeing.
Thanks. Hi, I'm Ben Riley. I'm the new Chief Medical Officer at Bob ICB, started last week.
I'm Prue Bray. I'm the Deputy Leader of the Council. I'm the Lead Member for Children's Services. And welcome, and I hope you're going to enjoy working with us.
Hello, Ben. I'm Stephen Conway. I'm the Leader of the Council, and I'm Executive Member for Housing, that's affordable housing, partnerships and planning and the local plan.
Okay, on the video we've got Nick.
Hi, I'm Nick Fellows from Wokingham Volunteer Centre representing the voluntary sector.
Professor Keith Brown.
Good evening, Keith Brown. I'm the chair of the Western Berkshire Safeguarding Adults Board and very delighted to be with you this evening.
Nadia Ra. Narendra, sorry.
No problem. Thank you.
No,
Hi, everybody. Good afternoon. I'm Narendra Bra. I'm the Head of Community Safety and Enforcement for the Council.
Jyoti.
Hello, I'm Jyoti Attry, Interim Director for Public Health. Nice to meet you all.
Rebecca.
Hello, I'm Rebecca Margetts. I'm the elected member for Finch Hampstead.
Emma.
Good evening, I'm Emma Cockrell. I'm the Director of Children's Services for Wokingham.
Karen.
Thanks, I'm Karen Evans, Domestic Abuse Coordinator for Wokingham.
Alice.
Good evening, I'm Alice Clifton. I'm the Lead Officer for Health Watch Wokingham.
And Sarah.
Hi, yes, Sarah James. I'm Head of Quality Assurance and Safeguarding.
Thank you all very much. Do we have any apologies?
Yeah, George Ramalico, Andrew Statham and Matt Pope.
Thank you very much. And then the minutes of the previous meeting. Can we all agree those minutes, or have we got any comments?
Yes.
Got a comment?
Yep. No, I was going to second that and then say I do need to declare an interest in the next bit.
Okay. Well, the next one's to declare an interest. So, yeah. Okay. I'll just a minute. So you're seconding the minutes. Okay. Is that all okay with everyone who is here? Okay, thank you very much. So, declarations of interest.
I need to declare an interest in item 50 because I'm a trustee of Kaleidoscopic and they are in the document as one of our partners on domestic abuse.
Okay. Has anyone else got any declarations of interest? I don't think so. But yeah, thank you for declaring that interest. Okay, there's no public here for question time or members' questions. So we've got the Royal Berkshire NHS. We haven't. Sorry. We've got the appointment of a vice chair. This is just for one meeting, the April meeting. I'm afraid I won't be here in that meeting as well, so they'll have to take that. So, can anyone nominate themselves to be vice chair just for the April meeting, and then we'll obviously go through this again in May.
May I ask a question? Does it have to be from a particular background? Can it just be anybody?
Yeah, it can be anybody but me. Everyone's champing at the bit.
In many ways, it would be, I think, quite important if one of our partners were to be the vice chair. It would, I think, embody the spirit of partnership better than another councillor doing this. So I guess we have to see whether any of our partner organisations are interested in stepping forward to take this great honour on for one meeting.
One meeting. But they will be chair of it, so... Distinct silence. I think, what we'll do is, obviously we'll appoint someone for this one, but then perhaps we'll talk to our partners to see if someone else would take on the role in May. But, yes?
David, sorry, I'm just trying to volunteer, but I can't work out how to put my hand up. Sorry, David, Nick Fellows, I can't figure out how to get my hand up on. Subject to the date, I could do that if nobody else is able to.
It's the 10th.
I guess.
It's the 10th of April.
Oh, right, okay. Oh, I found it, that's right.
That's okay?
Yeah, that should be okay. If you need me to, I can do.
That would be most appreciated. Pardon? So, do we have to vote for that? Yes. So I'll propose that Nick is the...
And I'll second.
All those in favour? Before he changes his mind. Okay. Thank you very much.
Thank you.
Right.
Thank you, Nick.
Thank you very much. So we've got the domestic abuse strategy with Narinda and Karen, I believe.
Yeah, thank you very much, Chair. So I'm just gonna open before Karen's pulled together some slides that she's going to share with the board. Brilliant, thank you very much, Karen. So I'm just going to open just before I hand over to Karen, just to say that the current domestic abuse strategy that was the first for the borough after the Domestic Abuse Act was passed in 2021 is now at an end, and we have spent a great deal of time working in partnership and with our stakeholder colleagues to put together what is a very comprehensive and very collaborative piece of work in respect of this new domestic abuse strategy that takes us through to 2025 through to 2028, which is a good length of time to build on the current work that we started as part of the strategy that we've got currently running. You'll see as part of the priorities, when Karen gets to the sort of slide to outline the priorities, early intervention and prevention is strongly threaded through this new strategy, as are children and young people, and holding perpetrators to account. And the thing I wanted to highlight, as well as delivering support in safe accommodation, the thing I wanted to highlight in respect of this strategy was that in many ways it is a continuation of the work that we have started, but it is also greatly affording us the ability to work in much closer proximity to deliver some of these priorities that we've only just managed to make really small amounts of indents on, given the size of the task that is ahead of us. So I'm going to leave it there, and I'm going to pass on to Karen, who wants to just give us an overview. I'm sure many of you would have seen this strategy as part of either your DLTs, your department head groups, or as part of the wider stakeholder contribution that you've put into this. So for that, I want to thank all of you, because I know it has been a lot of hard work to pull this together. And I'm really looking forward to working with all of our partner stakeholders to deliver what is going to be a real challenge across the next 3 years, together with our challenges in accommodation across the board, which is a great part of the strategy in relation to providing safe housing, but also in relation to early intervention and prevention to try and reduce service demand in this area of specialism. So, Karen.
Thank you. Hopefully you've had time to have a look through the report and also the strategy if you hadn't seen it before this meeting. as Rinda says, really building on what we've already been working on. With domestic abuse, we're really trying to make sure that actually everybody in our area who is affected by domestic abuse knows how to access support, and that the support they're accessing is the right support for them so that they can move forwards with their lives. So rather than before in our previous strategy, we kept the safe accommodation, that's our statutory duty, that element of the strategy quite separate to the wider, much more wider sort of support that people need where they're affected by domestic abuse. This time we brought it all together into the one and really kind of got those 4 key things that we're having as our key priorities, so we can really kind of focus on those. So that early intervention prevention, looking at how we raise awareness, how we make sure that everybody knows that there is help available and how to access that. The support for victims, survivors, and also including children. After the Domestic Abuse Act 2021, as hopefully a lot of you will know, children are now seen as victims in their own right. So we really need to make sure that that support's available. At the same time, we need to try and get perpetrators to change their behaviours, because if we can turn around the lives of those who are actually abusing others, controlling others, that will then, obviously we won't have any victim survivors if we don't have any perpetrators. So really kind of working on that element. And then obviously our statutory duty, which is to deliver support in safe accommodation. Safe accommodation is defined as a refuge, domestic abuse refuge, dispersed housing, as well as emergency and temporary, but it has to be only for domestic abuse victims. So it's quite a limited remit, and alongside that, target hardening our sanctuary scheme, which we call the home refuge scheme. So that is what the government is classing as safe accommodation and relates to our statutory duty. So within this strategy, we have got an appendix which details all the people, the cohorts of people that we're worried have additional barriers to overcome when they're trying to get help and when they're reporting incidents. So it's a bit like a equality and diversity kind of part, which is actually included in the strategy appendix, to really set out how we've really kind of thought about the needs of different people. A lot of people will have more than one protective characteristic. We've also got people who will have complex needs. So really trying to, to explain actually what barriers we're kind of thinking about, what the concerns are that we've got, which will really, really help us to inform our detailed 3-year action plan, which will be linked to the strategy. So delivery of the strategy is through the Domestic Abuse Networking Group. So that's all the support that is provided to all those affected by domestic abuse, includes perpetrators of domestic abuse and all the work we do, that holistic work. And then we've got the Domestic Abuse Partnership Board, which specifically focuses on delivery of our statutory duty around the support in safe accommodation. So just to reassure you, we do an annual data collection where we get information from all the organisations across the borough that are supporting those affected by domestic abuse. And we pull that together to try and get a real understanding of what's going on, because we know that for a lot of victim survivors, they might not want to report what's happening to the police, or it might be that there's kind of other issues. And what we want to make sure is that we've got statistical representation as far as we possibly can, that actually people from different groups with protected characteristics are actually being able to access services. So really kind of looking at the data from our Commission Domestic Abuse Service to see actually what, where the percentages are within that data, how many people we know have got a protected characteristic, and is a specific piece of work we need to do around that. Progress against our strategy and all the actions that we're doing will go from those networking group and the partnership board, then go up to the community safety partnership, and then up to yourselves as a health and wellbeing board. So when we're thinking about what will good look like, what would we really like to have achieved at the end of the 3-year period, we know that it's after the 3 years, there's going to be another 3-year period. It's going to continually building on the work that's happening. But we particularly want to increase the amount of safe accommodation we've got, because we really, we've at the moment we've just got 3 refuge spaces in our borough, whereas recommendation is 1 per 10,000 population. So we really want to expand that if we possibly can, particularly around dispersed accommodation, so people get a lot of support but it's perhaps within self-contained accommodation where perhaps going into a refuge wouldn't meet their needs. We also really want to increase the support available through the domestic abuse services, and that's all of the services that we've got working in the area, particularly looking at the support for children and young people, because we know that that's an area where, we really do need to do some more work on that. And then also, that our campaigns, the activities that we're doing are really helping to increase that representation across all the groups. So in terms of what's next, obviously we're here at the meeting today to seek your sign off of the strategy, so we can then take that forward to the executive, which will be in May, I think, and then the strategy can be published on our websites. We're also finalising the 3-year action plan, which will start on the 1st of April, because that kind of works out easier in terms of financial years than that. So that 3-year action plan, we've got 2 action plans. One will be for the networking group and one for the partnership board, but very much kind of pulling all that work together. And then obviously we will regularly update you as often as you want, really, on progress towards that. So that's kind of the overview, if that's okay. Obviously got contact details for myself and Narinda if there's anything you wanted to discuss with us after the meeting. Thank you.
Sorry. Thank you very much, Karen and Narinda. So it is on. Thank you very much, Karen and Narinda. Has anyone got any questions about the... Stephen?
Not really a question, but just a thank you to both Karen and Narinda for the work that's been put in drawing up the strategy, and to say that it all looks very encouraging. Obviously, the action plan is going to be vital, and we look forward to seeing that in due course. But thank you very much for all the work.
Thank you.
The bit I wanted to say is really about, I'm grateful for the actual explicit mention of children now, and I think it's utterly shocking that before 2021 children were not even considered in this. They had no rights at all. It's terrible, absolutely awful. So this looks good. I'm hoping it's going to have a really good action plan attached to it. I'm sure it will, and that we can find some of those extra spaces for people, because that's obviously going to be quite important. We're well below what we should have, but at least we've got something.
Ben?
Thanks. Just to add to that, I also welcome that focus on survivors and children, and I particularly like the sort of prevention focus and that wider consideration of preventing sort of recurrences through addressing the behaviour of perpetrators and the accommodation side of it. So I think it looks like a sort of good comprehensive approach to it.
Stephen again.
Ben's comment just prompted me to say prevention and early intervention are really vital features of the Council's general approach to a whole range of things, because it just makes great sense to try and reduce or control demand for services, and you can do that best by either preventing the need for them or intervening early enough to reduce the intensity of the demand on services downstream. So this is an approach that is clearly very important in this document, but it's one we're trying to pursue more generally. So I think it is really important, and thank you for highlighting that.
Alice?
Thank you, Chair. Narinda and Karen, I'm sure, Narinda, you've thought it through. I'm sure Karen did. But cultural awareness is very, very important, because I do think that, not many people are aware that it is wrong to be violent to anybody. So I do think there's an emphasis is needed to make sure that, because it's not necessarily diverse communities, it's all communities, that this isn't wrong kind of thing. So I do think there's a need to be a message out there that is not acceptable. So, the messaging the messaging has got to be simpler, because, and people, I think the narrative also has got to be different, because for people to engage. So
Yeah,
there's something that we need to look at. Yeah.
absolutely. Yes. Thank you. Thank you for that, Alice. And I think I can second that from a cultural perspective. Absolutely. I think what's also really, really key for us from a strategic perspective is we've got a changing geographic landscape. So our cultures and communities in Wokingham are changing, and they're changing rapidly. So we've got a growing population base. We've got possibly more development, no doubt, also following on from that. So we need to be really, really clear in terms of working with our partners in public health from a population perspective, but also wider from a health perspective, and all other stakeholders in recognition of understanding that population. And this is part of understanding that population will be about ensuring that we can react and we are flexible within Wokingham to be able to recognise what the new dynamics of the changing populace looks like, so that we can respond to it from a service demand perspective, but also have the other eye, if you like, on prevention and intervention. So it's a two-pronged approach from that angle, but also, like I said, a triangulation of understanding who our new population are, where they are, and what their needs are as well.
Thank you.
Thank you. I've just got a question. As my son and I are both victim survivors from different incidents, and so we're male victim survivors, and certainly I know that I never said anything about mine, really. I know my son did. It went to court. The person got a desultory sentence, and he has suffered for the rest, well, he's still suffering through that. And is that something that you're taking on board, that men are much less likely to report it, and often not really believed when they do report it either?
Yeah, totally. And I'm really pleased that Cranston have recently, in the last 6 months, they've now got a male victim lead within the service to really kind of support male victims, encourage that. They've also got a monthly drop-in now for male victims, which is sort of gathering momentum, and more people are feeling able to access that. So absolutely, because I feel very passionately like you do, that we need to make sure that everybody who needs that help can get it. And for a lot of male victims, that's really difficult. So we're really pleased that Cranston are doing that work. We've got Project Salama hold bi-weekly drop-in sessions as well for diverse communities, particularly thinking about those who might be affected by so-called honour-based abuse, female genital mutilation, forced marriage. So, you know, it's really nice that we've got these kind of activities and these projects which have kind of recently started up. We also really involved, we've got Professor Ben Hines has done quite a lot of work for us with the homelessness team, and also looking at housing, because we have a massive underrepresentation of male victims coming through for home refuge scheme and also for our homelessness scheme. So really kind to explore some of the barriers and really work closely with us. But yes, absolutely, we really want to make sure that everybody who needs help feels that they can, and there's no barriers that we're putting up in place. But thank you, David, really appreciate that.
Yeah, and I'd just like to add to that, Chair and David, that we have Mark Brooks, who is the CEO for the Mankind Project, sits on our domestic abuse partnership board that's been recognised nationally as good as the sort of one of the gold standard good practice boards across the country. So I like to say that whenever I can, because I'm obviously very proud of that, Karen, and the board's achievements. So the Mankind Project is well and truly centrally involved in the development both of our work strategically, but also operationally as well. So really, really championing that area of work strategically, but also operationally for us.
Thank you very much. I think that's all the questions. Thank you very much indeed for this, and it'll be interesting to see how this goes on and look at the action plan and so on, and how it's worked out in practice, because often that's the important bit, isn't it? So, but thank you very much for all the work that's been done, and please thank everyone else who's been involved in this, because yes, you've been at the front, but there's been other people as well, and it's great. You know, it's a group effort, and that's important to acknowledge. So thank you very much indeed.
Thank you, Chair. And yeah, just to acknowledge as well, Sarah's chair of our networking group. So Sarah James, so that's really, really helpful. So really, again, keeping children really at the centre of a lot of what we do. So really appreciate her help, and of course all the work that Kaleidoscopic do, and Alice involved with our group as well. So thank you to everybody.
Thank you. Okay, we'll move on, and it's Professor Keith Brown and the West of Berkshire Safeguarding Adults Partnership Board and report. Thank you.
My pleasure. Thank you very much. So I'm going to have two sort of things to say. One, to present the report, and then also to ask for you to endorse the revised Safeguarding Adult Board and Health and Wellbeing Board protocols. You've got the annual report, so I won't go through it in detail, just make a couple of comments. Last year, when I was able to join you, I made comments about the need for us to embed a better understanding of the Mental Capacity Act across the system. I think we're making good progress with that. I think the issue that we probably have occasionally now is getting people to understand that capacity is not often binary. It's not yes or no. Often people are in the middle of a situation, and an area that we talk about often now is executive function. Does a person have the executive ability to understand the situation, that the decision that they're thinking about, to make sense of that? And the way I often describe that was when I was caring for my own mother, as she was in the early stages of dementia. If you ever met my mother at that time, you would be certain that she had capacity. She was able to converse with you, and she would appear somebody who was capacitous. However, if and when, for example, she took a packet of ham out of the fridge and looked at the sell-by date, she could read the sell-by date, but she didn't understand what the sell-by date meant. She didn't have the executive function ability to make sense of the processing of the information that she was understanding or reading. The question then is, of course, if my mother, with her lack of executive function at that moment, had eaten that ham well beyond the sell-by date and given herself food poisoning, was she self-neglecting, or was she suffering from an executive function situation whereby she was not able to understand what was happening to her? I hope that makes sense, and I hope that kind of expresses what we try to understand by executive function. So we're increasingly having to move into that much more nuanced situation with people. It's not so much, yes, they have capacity, or no, they don't. But particularly in the early and middle stage of dementia, do they have the executive ability to cognitively process the information, make sense of the information, and utilize the information? That will come back into my conversation in a couple of minutes' time in the area of financial fraud, because often people don't have the executive capability to understand what's going on within finances, and that's where fraudsters and criminals often prey on them. So as I say, I think we've made good progress on that. We're making pretty good progress around the whole area of serious violence and exploitation, and we've had a number of SARs. They've gone well, the reports are out, and we've had good learning from those. You'll note in our report that, just following on from the previous presentation, the number of incidents of domestic violence is going up, and domestic abuse. I think that's probably partly because, as we were just hearing, the Act is felt relatively recent. We're having a much greater understanding of the whole issues around domestic violence, particularly around coercion and control. You'll also see there's quite a large increase in incidents of financial abuse. And an area that I'm personally nationally very interested in is, what about the issues of financial abuse within the situation of coercive control within families? And that's something I think in the next few years we across society are going to pick up much more and be much more nuanced on. The final thing I'd like to say before I take a pause for any questions about the annual report is I'd like to elicit your support as a health and wellbeing board to try and make sure we support the advocacy projects that are out there. I think advocacy for people in distress, particularly in areas of mental health crises and these sorts of arenas, are absolutely critical. And I just think that we need to do all we can to ensure that the pressure on our budgets and the pressure in the system doesn't mean that advocacy gets lost or misplaced. I just think that there's too many examples in our SAR reports, both locally and nationally, where advocacy wasn't available, that we must realise that we need to do all that we can to support advocacy. So I'll take a pause. You've got the report. There were just some observations and some thoughts. Happy to take any questions, and then we'll go on to the protocol.
Thank you very much. Has anyone got any questions or comments? Rebecca?
Thank you, David, and thank you for the report. It's incredibly detailed, a lot of information in there. And obviously we see a lot in the press recently, and I'm sure you will see this about safeguarding incidents with vulnerable young adults between boroughs, and where there are incidents with mental health issues where there have been some tragic cases where safeguarding concerns haven't been passed on from borough to borough. I'm sure that's something you're very aware about and that you're looking at, but be interested to know your thoughts on that.
Yeah, I think there clearly are instances where there are issues like that. I don't think it's potentially as bad as it's put across in the press. I think that the two issues: mental health services generally, nationally, regionally and locally, are under huge pressure. I think if I had two areas of safeguarding concern in any board, in any place, in any area, it would be, are there sufficient mental health services to meet the needs of the communities that those places are trying to serve? And the answer is, at the moment, we're way off target and we're way off demand, which leaves many young people waiting a long time for support and care, and all adults. And that situation often means that we keep having too many tragedies because somebody wasn't supported, helped appropriately in time, etc., etc. My other area of concern would be, I think we are rapidly reaching a position where there are many citizens that believe if they've got sufficient money, they will be able to pay for their care in later life. I think we are rapidly reaching a situation where there will not be enough carers, there will not be enough care homes, and whatever money one has, the capacity in the system to care for a growing number of older people is going to be a problem, and potentially a safeguarding problem. So I just think the society that we're in at the moment, we just have to face up to the fact that the pressure of resource, be that human resource to deliver a service or human resource to deliver the mental health service, is really stretched and cannot be stretched much further, but it does appear to be being so year by year.
Thank you. Anyone else got any questions? I don't think so. So you want to go on to the protocol, I believe?
Yes, please. Although as I do that, I would say that one of our key priorities for next year is for us to look further at financial abuse and scamming. And I think I'm saying that partly because I think that has an impact not just across the Safeguarding Adults Board, but also with the Community Safety Partnership, and indeed with yourselves and the Health and Wellbeing Board. Victims of fraud, particularly older, lonely people victims of fraud, it often has a consequential knock-on impact on their well-being and their health. And so I think it affects all of us as boards, which is why I sort of a lead into really saying that we recognise that the protocol agreement for working across the Safeguarding Adults Board and the Health and Wellbeing Boards was over 10 years since it's been reviewed. So we have reviewed it. And I'm presenting it to you really to seek your endorsement with the other two health wellbeing boards, West of Berkshire and Reading. They're being done separately, to simply say, here is our proposal for our newer protocol agreement for working between us, and I'm presenting it to you hopefully for your endorsement.
Thank you very much. Has anyone got any questions about the protocol? Don't see
it's not radically different, David. It's literally just some tidying up and bringing up to date.
Yeah, and yeah, I think it's been brought up to date, and that's what matters really, and so on. So, and that's important. So, I will propose that we endorse the protocol. Stephen will second it. All those in favour? Is anyone against? I don't think so. So that's passed. So that's the first hurdle. So thank you very much. I think now we go on to the Berkshire West Safeguarding Children's Partnership. And is that you again, Professor Brown?
No, not me.
Sorry, no.
It's me.
Sorry,
Good evening.
Sarah.
That's okay. That's okay. Not a problem.
Thank you, David.
Yes.
Thank you, Sarah. We don't want to do your report.
And thank you for all your work.
Pleasure.
Okay. Is it?
Sorry,
do you like
Sarah.
me to?
Yes, it's your turn.
Over to me.
My fault.
Okay. Not a problem. Yes. So yes, I'm here to present the Berkshire West Safeguarding Children Partnerships annual report, which I believe you've all had been able to have a look at. It provides a summary of activity of the work that took place in 2023-24 and the progress undertaken by the multi-agency partnership to promote safeguarding and wellbeing of children in Reading, West Berkshire and Wokingham. And I'm going to focus on the activity, for Wokingham. There was, in terms of sort of outcomes from that year, there was a creation of the Berkshire West neglect strategy, which included adoption of neglect screening tools and demonstrating a kind of systemic approach to identifying and addressing neglect across the region. We also had a focus on extra-familiar harm and contextual safeguarding and exploitation. There was it was agreed that alignment would there were lots of disparities across the region, but we do have the Wokingham Serious Violence and Exploitation Strategic Board, and there are 6 work streams under that that look at data targeting, community partnerships and early intervention, community lines and the misuse of drugs, law enforcement and criminal justice, and the Children and Young People Survey and consultation and engagement events. There was also the establishment of the Berkshire West multi-agency safeguarding hub and front door arrangements leadership group, and that was to develop auditing practices and assess the effectiveness of safeguarding measures across the partnership, ensuring accountability and identifying areas for improvement. And there's the development of the partnership learning and development training offer, and the establishment of learning and development, which expands training opportunities for partners involved in safeguarding, and making sure everybody's up to date with their knowledge and skills in regards to safeguarding practices. There's also been the continuing development of the partnership, which has included the formation of the delegated safeguarding partners and lead safeguarding partnership groups, and looking at how we engage education groups across the Berkshire West footprint at an operational and strategic level. And then in terms of activity in Wokingham, specifically in Wokingham, we've had the strengthening of our early help offer with the creation of a head of service role, helping early and community prevention, and developing relationships with statutory and voluntary partners. There's also been an additional head of service role for children with disabilities, and that's led to the development of the designated social care officer for children with SEND. And then our helping early strategy is being finalised at the moment, and that's sort of bringing together the local offer for children and families who require additional help and support. There's been a lot of transformation work within fostering as well, in terms of how we recruit, assess and support foster carers, and that's included the recruitment of family support workers to support the introduction of a project called Mockingbird, which is a model that kind of nurtures relationships between children and young people and foster carers that helps build resilience. And we've also been involved in a joint bid and as part of the regional fostering hubs and that was introduced as part of the independent review in children's social care. And I think we're launching our second Mockingbird constellation, so it's been quite successful. We've also invested funding in supported lodgings for Wokingham's children and care leavers, with the aim of adding 10 new households. And Wokingham will be is opening in the process of opening its new own residential children's homes. There's also been the opening back in 2022 of semi-independent living provision, which offers accommodation to children who are 16 plus, and the plan is to double this offer in 2025. We also were successful, had a successful bid for a Staying Close grant funding, which provides enhanced support for care leavers moving on from semi-independent provision and into step-down accommodation and independence. In 2024, there were 2 transitionary accommodation buildings for 10 of our care leavers with floating support, and there's further developments planned in 2025, so in this year. And then I guess in terms of the workforce, there's been a range of approaches for the recruitment of social workers, to reduce the reliance on locums, and we now have a head of the academy, principal social worker in post, to kind of support a very strong programme of support for newly qualified social workers in their first year. In terms of kind of governance has been put into we've set up new practice and outcomes groups across the children's services, and that's to help us ensure that we know ourselves and that we have the right plans in place to support continuous improvement for children open to social care and for those children who have special and additional needs. So yeah, that's the summary of the report, and yeah, welcome any questions.
Thank you very much. And again, the reports, there's a lot in the report and so on. It's very interesting to read. Have anyone got any questions or comments? Prue.
A couple of comments. First one is Sarah referred to the regional fostering arrangements and partnership that we're moving into. I thought what she didn't say was that we're the first local authority in the South East Regional Fostering Partnership to have been approved. So that's fantastic, and well done to everybody. And the other thing is that at the end of the year to which this report refers, David Goosey stepped down as the chair of the board, although he still remains involved. And I think perhaps we should thank him for his service. And I believe Emma is now chairing it. Is that correct? And so good luck to her. And thank you for taking that on, Emma.
Thank you, David. Thank you, Prue. David Goosey remains the independent scrutineer for the Safeguarding Partnership. And just to note that we share that with Reading and that partnership with Reading and West Berkshire.
Thank you very much. Are there any other questions? Doesn't look. Oh, Philip. Hello.
Thank you, Chair. Just a quick question from me, not necessarily in regards to the report. The report's great, but just wondering if you have any VCSE representation on the Safeguarding Board at the moment. So it's just my question around that, please.
So not within the delegated Safeguarding Partnership, Philip, but one of the actions for this forthcoming year is looking at how the safeguarding how that strategic group is replicated within within local partnerships, and certainly conversations will be happening with BCFS partners in relation to the really important role that voluntary and community sector play in those local partnerships in relation to to safeguarding and supporting children.
That's great, thank you, Emma. Obviously, recognise the differences between the two, as you said there, and that reflects the kind of practice that we're seeing in Bracknell Forest too. So, really grateful for that, and should look forward to further conversations. Thank you, Chair.
Thank you very much. Any other questions? It doesn't look like it, so I'd like to thank you again very much, Sarah, and everyone who's contributed to this. I'm sure Emma's been involved and others as well. So please thank everyone for it, because it's a very positive report and very well written. So thank you very much indeed. Okay, so now we go on to Bob, and that's Nick.
That's okay, no problem. Thanks very much. So there's a report in the papers giving sort of updates on a number of items. I thought it might be helpful just to cover a few of the headlines, and then obviously happy to take any questions. So there's an update on the system planning. The ICB received the NHS England guidance a bit later than normal. Normally that appears on Christmas Eve, actually. Often they send it out, but this year it didn't turn up till February. So that's still quite a live process that's underway at the moment. It's very much a sort of technical, financial, operational planning process, really, about marrying up the plans around how much money is needed, how much workforce there is, and then the sort of numbers around, you know, how many operations and outpatient appointments and things like that will be delivered, rather than being a sort of strategic planning process. In the guidance, there were some priorities given in terms of the performance of the system around reducing elective care, waiting times, improving A&E, and enhancing access to general practice and mental health services, which is relevant to some of the items I think we've covered this evening, and with a particular focus on mental health crisis pathways as well. So that work's underway and will be shared in due course with place partnerships and so on. The Community Wellness Outreach Programme appears to have gone very well, really. That's being updated in all three of the Berkshire West Health and Wellbeing boards, and a significant number of patients have been sort of case found, if you like, in terms of, through that, in terms of this is looking for things like high blood pressure, high cholesterol, those sorts of things. So that's really trying to target populations that would not normally be found through, sort of usual contact with health services. The financial position has actually improved fairly significantly since the last meeting, I think, in terms of, I believe the system at the moment is roughly on track for about a £60 million deficit against a spend of about 3.6 billion. So it's not that bad in that context. But that's, yes, but obviously still aiming for break even. So that's for this year. Next year remains challenging though, in terms of that planning, in terms of the, making all the numbers add up, really. The joint forward plan, NHS England requires ICBs and partners or partner trusts particularly, to prepare a joint plan for their functions, and the plan was a limited refresh expected this year, with a more extensive revision following publication of the new 10-year health plan for the NHS later in the year. Things might have changed today though, because NHS England has slightly unexpectedly announced a significant reduction in resources for ICBs, as well as the NHS England sort of central team, of 50%, which is quite a staggering amount. And obviously that's come as a bit of a shock to the ICB team and the staff, and we don't have any further details than that really at the moment, so we're obviously waiting to hear with bated breath what that's actually going to look like and the implications of that, but that could be quite significant in terms of how we work as an ICB and also align with other partners and so on. There are some areas that we're sort of expecting to be emphasised around reducing the progression of ill health, transforming care models, improving care for disadvantaged communities, and optimising how we deliver care more efficiently. But there is a significant risk, I think, now that could be slightly complicated by a lot of organisational change again in terms of those sorts of changes to staffing levels. And rather ironically, of course, the ICB has just completed its staff consultation and restructure and transition to its new operating model. Staff have been through quite a process there, and so it's quite challenging for them to be told that this is probably likely to happen again, unfortunately. There are now executive sponsors in place, which is why I'm here this evening. So we have one for each place now, and looking forward to working with partners and colleagues to develop those more effective working relationships. There's still some practical issues around that to sort through, but hopefully that signals a very positive step to have that senior engagement. There's an update on working with local people and communities, because I think it would be fair to say the ICB's recognised that its engagement with the public hasn't always been as consistent and effective at times as it could have been, and is addressing that through the new operating model changes, for example, by creating a new Chief Strategy Digital and Transformation Officer post that's supported by an Associate Director for Comms and Engagement, which is very much focused on reviewing the whole sort of approach to strengthening public involvement and drawing insights from partners and communities. And I'm conscious that's often a theme that, you know, people raise in meetings such as this in terms of needing to improve that. And also that part of that is also around supporting national engagement in the forthcoming NHS 10-year plan, and no doubt there'll be a lot of work for that. And there's already been some staff engagement work starting with that, but I think that will also need to be broadened out, of course, to members of the public. And then the final update on there was about a change to the non-emergency patient transport services. EMED Group has been appointed to provide that service starting from April, and that new contract, as you might expect, includes quality indicators and regular sort of monitoring to ensure that that transition goes smoothly and that the new service is delivering what patients need. So that was the update.
Okay, thank you very much indeed. Can I ask you, you say that NHS England has told you but then NHS England has been done away with. So does that make a difference?
I think they were passing on, so that there's a new interim chief exec in place now to do some,
No.
or maybe it's changed even since since I drove here in the car. I haven't seen the news for the last few hours, so it might have changed again. But as of about 3 hours ago, it was the case that they'd basically briefed our chief executive that there would be that reduction coming, but couldn't give any more information. And it's got into the media, so it's now in the public.
Got through then, Stephen, then.
I was going to say, you're remarkably composed for somebody who has been put in that situation. It beggars belief how they expect you to deliver services with that sort of reduction. I just don't, you have my absolute sympathy, because it's going to be really challenging. It's really challenging as it is without that. So even more importance for us to work in partnership and make the best of our resources jointly.
Yeah, that final point was the one I was going to make, really, that it's sometimes tempting when things are really grim, as they are when you're facing that level of reduction of funding, to look inwards and just huddle down and try and batten down the hatches and hope that the world will go away for a while. But our experience is looking outwards and embracing the opportunities of partnership is the best way in these circumstances. And however grim it appears, we're all facing a grim financial situation. So working together is a way in which we can try and help each other to overcome these challenges. So we're very willing and keen to work with you as effectively as we can.
Well, thank you for that. And I was just going to say that obviously the NHS staff have been through a lot in the last 5 years, and it did remind me a little bit of some of the discussions around the pandemic and the strikes we've had and other things that we've had to deal with. So I think part of that calmness might just be that this is a sort of latest in a series of challenging things that we've had to deal with recently.
Yeah, I think probably what will make it more difficult for staff is there was an expectation and a hope that things would be getting better, and now suddenly it's actually been made appreciably worse.
We've got Rebecca and then Alice.
Thank you, David. I wanted to endorse what Prue and Stephen said. It is extremely concerning to hear what you've got to say, and obviously I do have concerns with us as a borough in that unfortunately we tend to receive a little bit of the short straw here in Wokingham and with our funding, and there are some inadequacies. So I understand what Stephen's saying as well about partnership working, but obviously we need to speak for our residents and the services that our residents need and make sure that there's a fair outcome. So I'm not expecting you to answer that, I'm just expressing a view.
Thank you, Rebecca. Alice.
Thank you. Thank you, Chair. Welcome, Ben. I think you've come in at a time where it's very, very challenging period in every corner of health. But my question is also ICB has just changed providers for translation and interpreter services, and they've not communicated that. We need to know who they are, because Royal Berkshire Hospital has got a service, council has got a service, but they have just commissioned somebody in the ICB. We don't know anything about that. Secondly, and I'm sure you've heard this from West Berkshire about women's health, there is inequity in Berkshire West when it comes to women's health. Oxford has got a hub. Buckinghamshire has got a hub. We haven't got one. So, and the thing is, so we've got a pilot scheme that the funding is going to be finishing soon. After that, what? And we've been told by the ICB as collectively to find out money locally. And I think if you're going to provide other services, you should also provide this, because there is a women's strategy, national women's strategy. Why Berkshire West hasn't got one? So I do think because we are perceived as the poor child or the poor borough kind of thing, Berkshire West is small, yes, but we should be seen equal with Oxfordshire and Buckinghamshire when it comes to such services.
Thank you for highlighting those two issues. I'm new to my role, unfortunately, only a week in, but I will definitely pick up both of those and take that back, and I'm happy to get back to you. Obviously, we need to let you know about any sort of change to translation service providers, and so that one hopefully be relatively straightforward. The Women's Health Hub is obviously, I think that sits under my colleague Rachel Corser, but I'll take that back and see if I can find out some more about the sort of rationale behind the difference there. I think generally there is a principle from meetings I've been in so far, there is definitely a view that we need to sort of level up and any gaps over time, and that's definitely the aim, is to ensure that there is equitable provision everywhere. So, and I know there have been examples of that in Berkshire West where things have come on in the last year around some of the GP services, for example, that have been commissioned sort of locally to sort of that weren't previously available or were in other places in the system. So I would hope over time that will get addressed, but I'll need to take that one back, I think.
Thank you. I'm sorry.
No, it's good to raise these things. Otherwise, people don't realise the negatives as well. We've all. It's easy for things to slip through the net, and so it's good to raise these things and make sure that that Ben knows about them. Has anyone else got any questions? Well, thank you very much for that, Ben. We'll look forward to hearing you again. So, okay. Right, we've got the Health Watch report, and that's you, Alice, I believe.
Yes, thank you. Thank you, Chair, and thank you everyone for having this report onto the Health and Wellbeing Board. The reason for this is the fact that we are still hearing from the public that there are issues. I mean, I have sent you all a letter because I did say to Madeline I might not be able to attend, kind of thing. So I'm hoping that you've read the letter as well as seen the slides that I was going to. Would you like me to share the slides? Are you happy with the slides? And is there any questions you want to ask? Because I would like a support from the Health and Wellbeing Board, because this report is very important, even though it's an old report perceived as in 2023, but the feedbacks are still similar that we are getting. Many people are still struggling with long waiting times and difficult booking appointments. Over 35% of the survey respondents could not see their preferred GP. 33% face significant delay, despite the fact that new systems have been put in, like Anima. So, so I do think that we need to look into it again. Care navigators confusion, people are confused with the title itself. I mean, to be honest, this new system, this new way of working was set up in 2020. So I do think that we need to turn around and consider, why people are struggling with this as well. The digital services is also still a challenge. So, but also what I would like to do is, share with you that there are some additional research and reports that have been provided wider framework to consider. People still feel lost in the system. Women do not feel recognized or respected in the system. Some groups feel alarming lack of trust in the primary care. So Health Wokingham wants to see enhanced accessibility for all residents, and as such believe it is crucial to improve communication, provide multilingual research, streamlining appointments system, and engage in proactive community outreach. These efforts will enhance that all individuals, regardless of their digital literacy, can efficiently navigate GP services and access the care they need. I would like to see partners within the Health and Wellbeing Board take the lead on engaging with and encouraging providers to prioritize increasing communication with the public regarding the new way of working within the GP system, to ensure that they are providing clear, accessible information and targeting support to individuals facing digital barriers, so that people can get the care they need when they need it. Work effectively with the Health and Wellbeing Board channels to raise awareness, so that the public knows they can access the full range of services offered by different professionals, including GPs, nurse practitioners, mental health workers, and all allied health professionals. Our concern remains and is highlighted throughout the report linked above that people have significantly differing experience of health and health services, and that steps can be taken to ensure that services are accessible for all and do not leave the most vulnerable behind. This is an ongoing issue that is inevitably taking time to address, but falls in line with the outcome and expectations of the health and well-being strategy. So we would like to see this continue to be an active agenda item, and for the board to work with providers and monitor what actions is taken. Health Wokingham Borough will continue to feedback on the public experience and work directly with the Integrated Care Board to address this. Thank you, Chair.
Rue, you've got comments.
Yes, although the report was started a while ago, it's still true. There's still the stuff that we're getting from people. And what I'm very, well, there's two things I want to talk about. The first one is really the appointments booking system, the digital tools you have. So to try and bring it to what I think the issues are, we've got a system where when you try to book an appointment, it's all has to be, we're told now it has to be online. You have to go online, you can't phone up. Yet when you try to go online, the system only has enough appointments for that day. And then when it's used up all those appointments, it doesn't allow you to book appointments. So if you actually wanted to book something other than an appointment on the day, so you want to book a blood test or you want to book an appointment for next week for a routine something or other, you can't do it. And you can't do anything on that system once it's used up all its appointments for the day, which happens rather quickly, very early in the morning. So it's absolutely, because it also doesn't distinguish between the types of appointments that you need to make. So if you actually want to see a nurse practitioner and not a GP, or you want a blood test, or you want some other thing, there's a thing in the comment in there about ear syringing, but which is a rather strange thing. But so you want something else, you can't distinguish between those things in the app. So it's absolutely hopeless. It doesn't fill the needs of the patients, but it also frustrates the heck out of the surgeries themselves, because it doesn't help them, because everybody ends up ringing up in the end because they need to do something different to what they're being offered. So from what I can gather, they weren't actually properly consulted about what they needed to see in the app. So that's the first thing I would say, is that, for goodness sake, design, not you personally, sorry, I'm not getting at you, but people who are setting up these systems ought to be talking to the people who are going to be using them to find out what's actually required, because it doesn't fit that, and I bet people paid a lot of money for it. But being forced to use something that doesn't work is hopeless. It's really distressing a lot of people and frustrating, not just the patients, but the staff themselves. The other thing that I wanted to say is actually about, I understand why this is a general report. I think it would be really helpful for the NHS components themselves if you were able to supply information to them about which GP practices were having the most trouble and where the people were having the most problems, because that could help the good ones spread their good practice to the ones that are not so good. And we do know historically we have some very good practices. We also have one or two which are not very good. And I think that, I understand why it's not in a public report, but I think it would be really helpful to share that information.
As you said, it's good to...
Just a very small follow-up point or footnote to what Prue has just said. We were talking earlier on about the importance of prevention, early intervention, investing to save, all of these very worthy things that can control demand for services downstream and enable us to get better outcomes for residents. I mean, the frustration that Prue is referring to in terms of inability to be able to get appointments, in some cases, this is anecdotal admittedly, in some cases seems to be leading to people just despairing and deciding that they won't contact the doctor anyway. Now, it could be that sometimes people are contacting the doctor for fairly minor things that will clear up themselves anyway, but it's equally possible they're trying to get through to the doctor because they have symptoms which, if not addressed fairly early on, will become more serious and more costly to deal with. So the failure in the system at this stage of trying to book initial appointments can have consequences much more serious than frustration and annoyance. Yes. We could be actually storing up big trouble down the line.
Thank you. Has anyone else got any?
Okay. Rebecca.
Ben just wants to say something.
Sorry. Well, just to say I wouldn't disagree with any of that feedback, really. I should explain I'm a GP by background, and yeah, it's definitely a cause of a lot of frustration and confusion for patients, the sort of systems that have been introduced. Unfortunately, they do vary from practice to practice, and I thought it was an interesting idea about us looking at which practices get the best feedback and what we can learn from that and share that with the ones that are struggling a bit more with that patient experience aspect. Just in terms of some sort of figures overall, though, despite all those challenges, the number of GP appointments across Bob, grew quite significantly in the last, so the last data I got was between December just gone and the previous December, which was an 8.5% increase in the number of GP appointments in that year to a staggering 827,000 a month, I think it is, which is an incredible number. But that isn't to say that that's good enough, or that people are still not, people are still waiting too long sometimes, and I completely agree with the helpful comments in the Health Watch report, I thought, about the challenges around all these new roles and the different triage systems and things, and how that has created a bit of a confusion for people, and also that I think we don't always think about the equality, diversity and inclusion aspects of that enough as well. And that has been picked up by the team in the ICB and put into the communications plan in the primary care strategy in terms of addressing that as a particular issue. Also, another, just to finish, a positive development around the GP contract, which the government's negotiated with the British Medical Association, and well, that practices will be all required to provide online e-consultation access from October 25 throughout the time that they're open, not just for select times and then switching it off. But also, part of that is that they have to display information on their websites about how these systems work, and that's so this is obviously being reflected as a national issue as well. And so, but we'll pick those issues up, I think, to sort of see what more we can do to address the issues in the Health Watch report and the other feedback that people are receiving.
Thank you very much, Ben. Rebecca, sorry.
Firstly, I wanted to thank Alice for continuing to champion this. She knows, I know, we've sat in the HOSC and we have talked about this for years. Nothing changes. And we really, really need to, as a council, really push to sort this out. There is such disparity within the borough for GP services. I'm the lucky one. I live in Finchampstead. My GP is excellent. Yeah, if you live in the centre of Wokingham and you're under a certain GP in Wokingham, that service is very poor. And we hear this every single time when we talk to local residents. We really do need to push to do something about particular GPs. And I'm not going to name them because that's not what I'm here to do. But we also need to be holding them accountable and working with them to improve this. And we've got to keep going with that. This is nothing new that we're hearing today. And we're just talking about it, but we actually need to do something. And maybe this is something David Hare, you could pick up and really try and work here to try and address these issues with particular GPs that we're having these problems with.
Certainly, I can try, but I know, we have no power over GPs, as you know, and that is the problem. And I know Charles had a similar problem when he was in my position, and it's we can talk to them, but they don't even have to listen, and that's the thing. It's but we can. I'll try again. Okay, we've got Alice.
Thank you, Chair. But Chair, we have the primary care leads around. So Sanjay, he could come and share what they have done. Ben, I know, Ben, you're sharing what they, but it's taking so long. The problem is, when you turn around and look at this changes have taken place in 2020. I accept that COVID has, slowed things up, but COVID has increased a lot of things, changed a lot of stuff. But the communication to the public has been awful. And I do agree that nobody consulted the public before they were putting things in the system. And that is the thing that it's very painful to hear. Even with the NHS app, there are so many apps out there. Can we all, do one app? And I also still share the fact that people, we're using Anima, and I agree with you, Prue, in the sense that I've used Anima many times, and they kept on saying, "Oh, your password's expired. Go back and do this." And it's a constant frustration, and people are getting sicker, and our hospital, which is struggling at the moment with the building and everything, are struggling with capacity. So we need to do something. And then I think, I'm asking you to keep this on the agenda so that we can see some changes. Thank you.
Thank you. Someone else got any comments or questions? No. Thank you very much, Alice, and certainly for bringing this to our attention again, because it is something that we need to keep on at. But yes, I'm not sure where the answer is, but we'll go on pushing and trying to help. And I'm sure Ben will also try and work with us to do the best that we can for the people who work here. So thank you all very much for coming. I think that's everything. Yeah. So thank you all very much for coming and have a good evening. Bye.
Thank you. Bye-bye.